Hello guys, good evening. Welcome to one more Y Conundrum. And in this Y Conundrum, we'll be discussing about an important topic, which is most of you would be having their famous question that why nitrates and nitrites. I hope you know what is a nitrate. Nitrate is a drug which is used in terms of angina, a drug which can be increasing the oxygen supply and also decreasing the oxygen demand. Nitrates and nitrites and even nitroprusside. We'll be talking about nitrates and nitrites right now. Why these two drugs are not given with sildenafil? Why these two drugs are not given with sildenafil? So what exactly is sildenafil? And why these two drugs are not given together? That's what we're going to be discussing about right now in this Y conundrum. We'll keep it as short as possible. We'll keep it as crisp as possible. First of all, we have to understand that nitrates and nitrites. These nitrates and nitrites, both of these drugs, be it administered by any different route. It can be administered by peroral or transdermal or intravenous, or it can be inhalational. Any different routes is going to be. The final destination is it will reach up to the blood vessel. It will be gaining entry into the blood vessel. Yes. So here we're going to be drawing up here, guys. We have the blood vessel. And here is where your vascular smooth muscle is. Okay. We have vascular smooth muscle. The blood vessel is there inside, surrounded by the vascular smooth muscle. We have the nitrate molecules, which is present inside the blood. From the blood vessels, these nitrates is going to be gaining entry into the vascular smooth muscles. Nitrates will gain entry into the vascular smooth muscle. Now, once it is inside the vascular smooth muscles, nitrates will start releasing nitric oxide. Nitrates will be releasing nitric oxide. For this release to occur, it needs an enzyme which is mitochondrial aldehyde dehydrogenase type 2. Mitochondrial aldehyde dehydrogenase type 2, an enzyme responsible for the release of nitric oxide from nitrates once it is gaining entry into the vascular smooth muscle. This nitric oxide, once it is inside it, what exactly is going to be doing? This will be stimulating guanylyl cyclase. Guanylyl cyclase will be stimulated. As we know, guanylyl cyclase will be converting GTP to cyclic GMP. GTP to cyclic GMP. This cyclic GMP in turn is responsible for vasodilatation to occur. Most of you would be knowing about this particular one-liner, guys, and that is nitric oxide is a potent endogenous vasodilator. We have read it in physiology itself. But what is the clinical implication? This is the clinical implication. When you administer nitrates, which is going to be releasing out nitric oxide, that itself will be stimulating guanylyl cyclase, thereby it will be producing vasodilatation. And also, just deviating a little bit from the usual concept which we are discussing, this mitochondrial aldehyde dehydrogenase type 2 is accumulated more in the veins than in the arteries. Of course, it will be there both in the veins and arteries, but a little bit more accumulation in veins than in the arteries. That is also one of the reasons why nitrates, we say that it is more of a venodilator than an arteriolar dilator. So a famous question, again, we have discussed one more why over here, and that is why nitrates are more of a venodilator, because mitochondrial aldehyde dehydrogenase type 2 is accumulated more in veins, so there will be more action in veins. Of course, both veins and arteries will be dilated. Now let's come into this Y conundrum. Now, why sildenafil is not given along with that? What exactly is sildenafil? Say this cyclic GMP is there now. As we can see, cyclic GMP will be broken down to GMP. Broken down means it's going to be decyclated to GMP. For this process to occur, it needs an enzyme which is phosphodiesterase 5. Sildenafil is a drug which tends to inhibit this phosphodiesterase 5. Phosphodiesterase 5 is inhibited by sildenafil. Not only that, we also have tadalafil, vardenafil, lots of different drugs are there. So sildenafil, a drug which tend to inhibit phosphodiesterase 5. So what happens, sildenafil also tend to produce vasodilatation. Why? Because it will increase the cyclic GMP levels. Just a small recap of what we have discussed till now, guys. This nitrates and nitrite molecules, what it does, it increases the synthesis of cyclic GMP. I hope you are following that with me. Nitrates and nitrites will increase the synthesis of cyclic GMP, whereas on the other hand, your sildenafil, by inhibiting the phosphodiesterase 5, it will decrease the metabolism of cyclic GMP. Okay. When both of these drugs are given together, there will be more accumulation of cyclic GMP. So that's good only, no, sir, because in terms of angina, there is vasoconstriction. The blood supply is not proper. The oxygen supply is not proper. So when you give a vasodilatation, it's actually good for the patient. We expect that to happen. But unfortunately, whenever there is more cyclic GMP accumulation, there will be intense vasodilatation. Because of more intense vasodilatation, there will be decrease in the blood pressure, a sudden drop in the blood pressure. This sudden drop in the blood pressure, the body will take a look into it. Oh my God, this patient is suffering from hypotension. Sorry for that. So this body which is trying to adjust this blood pressure because the blood pressure is falling down, it will try to counteract the blood pressure by reflexly increasing the heart rate. There will be a reflex increase in the heart rate. So what happens, buddy? This reflex increase in the heart rate is detrimental in a patient with angina because when the heart rate is getting increased, there will be more oxygen demand, which will further worsen angina and we might lose the patient. This is the sequence of why sildenafil and nitrites are never given together. Because when you give it together, the patients might die because of this reflex increase in the oxygen demand, primarily because of reflex increase in the heart rate. This is the concept, guys, why nitrates are not given with sildenafil. Now we'll discuss one more point here. Say a patient is under nitrate therapy. Okay, patient is under nitrate therapy, and the patient wants to have a rough night, and he asks for sildenafil. You can't simply deny giving sildenafil because nitrates, when given sildenafil, there might be a reflex increase in the heart rate. He might land up in angina-like symptoms. But here we have one more query to be understood, and that query is, what if a patient is taking up sildenafil? Okay, what if a patient is taking sildenafil? Okay, and this patient has landed up in chest pain because of sildenafil, because there is increased oxygen demand, there is a chest pain which has happened in the patient. And this chest pain, patient is coming up to you. Usually when a patient is admitted for angina, the primary thing which most of the people are doing is administering glyceryl trinitrate. Sorbitrate will be administered in those patients. Now this will further worsen the condition. Okay, because glyceryl trinitrate is an emergency drug, buddy. How can we make sure that when do we not give glyceryl trinitrate, or when do we give glyceryl trinitrate when the patient is under sildenafil therapy? Please note down that if a patient when a patient is suffering from chest pain and the patient is getting admitted, and before administering sublingual sorbitrate for the patient, just have a single question. That question is whether the patient has taken sildenafil previously or not, or in the previous day night or not. If the patient says, yes, I have taken sildenafil, you should not administer nitrates up to a period of, these nitrates are contraindicated up to a period of 24 hours of sildenafil use. So previous day night, 8 o'clock, the patient has taken sildenafil till that next day night, the nitrate should not be administered. And we can give it in one more way. What if a patient says, no, sir, I have taken tadalafil? Okay, a very much famous combination, buddy. Tadalafil, dapaxetin. If you have visited Thailand, you would have known it very much clearly. Okay, so tadalafil, dapaxetin, tadalafil is there. Tadalafil is a long-acting drug. Tadalafil is a long-acting drug. And this tadalafil, whenever a patient takes, patient lands up in chest pain, and you are planning to administer sorbitrate for the patient. Now, till what time this drug is contraindicated? This is contraindicated till 72 hours of taking tadalafil, for till like 3 days. Or 4 days, we should not administer glyceryl trinitrate because it might further worsen the condition. Good. So we have discussed an important why conundrum. Why nitrates and nitrites are not given with sildenafil? Because both will increase cyclic GMP, producing intense vasodilatation, reflex increase in the heart rate. The second thing, what's the time duration between administering nitrates for a patient who has taken sildenafil? Contraindicated till 24 hours. And tadalafil, contraindicated till 72 hours. These are the different one-liners with this. Thank you so much, guys. We'll meet up in one more why conundrum as early as possible. Good night.